Doctors say that these cases of the soil-borne disease have surged after heavy rains, with over 20 infections this month alone. Dr. Stephen Donoghue is Townsville's Director of Public Health Unit, and he joins me now. It's a difficult word to say, melioidosis, but also we know that this is a rare tropical disease. Talk to us about how it actually manifests as symptoms in the body.
Oh, hi, Fausia. Yeah, so melioidosis is becoming more common and we've got record numbers. Depending on how this soil germ gets into the body, it can cause just different symptoms. A lot of people, if it's inhaled, they'll get fever, chest pain, cough, shortness of breath. But if it gets into the bloodstream, causing blood poisoning, it can be aches and pains, headaches, confusion, collapse, very serious symptoms. Even in very good hands, around 10% of people who get this disease die, but it's mainly in people who are elderly and sick. They've got underlying diseases like diabetes, kidney, lung, immune problems, and heavy drinkers. So,
what is the usual treatment for this illness?
Yeah, so they normally get intravenous antibiotics in hospital. Some of them are in intensive care, and most people are recovering with very good hospital care. There are a few cases that have a mild disease, for example, it's just in the skin. But yeah, it can be a very nasty infection.
Now, this is a disease that's mostly linked to the wet season, of course. Has there been an unusual uptick in the number of cases this year? Have you noticed that?
Yeah, the numbers are bigger than ever. The numbers you gave just now are only for Townsville. There's certainly a lot more in Cairns as well. We see this every year associated with the wet season. Look, the message is, if you're elderly and sick, don't go messing around in mud or flood waters. If you have to, then wear protective gear like boots and gloves. And if there's splashing or spraying, then it's important to wear a mask. If you do get those symptoms, go and see your doctor quickly.
Right. Now, there's another wet weather illness as well, dengue. Have you noticed a rise in the cases there as well in the flood affected areas?
Yeah, so dengue is a nasty mosquito-borne disease that's all over the world in tropical areas. We've got a good level of protection in North Queensland because we've released a strain of dengue mosquitoes that carry bacteria that block the spread. But we have had a handful of cases recently, a couple of clusters, which I'm calling a breakthrough infection. The protection with these modified mosquitoes is not 100%. So there are a few of the wild strain mosquitoes around, and occasionally there will be enough of the virus in a local mosquito for it to spread locally. So cases are coming in all of the time, and we've had a couple of little clusters this year that we're investigating.
Stephen, of course, many residents are going through this very painful process of picking up the pieces, wading through water, trying to clean up their houses, of course. I'm presuming there's a lot of mold as well. Are there other, wet season, flood-related type diseases they should be aware of? What sort of precautions should they take?
Yeah, so floodwater is often heavily contaminated, and so is the mud. Melioidosis is really just an example of the nasty infections you can get. Ordinary staph and strep, other things like Legionella and Vibrios that can cause infections, even in the slightest wound, particularly if you're vulnerable or have got a weak immune system. So the message there is, take it very carefully. And if you get even a tiny wound, wash it thoroughly, put on an antiseptic and a bandage. And if there's any concern, see your doctor about it.